Again, community member Greg sent in this question. Can you discuss any future or potential changes to using stem cell transplant for myeloma patients? How would you counsel patients who do not want to pursue a transplant as a treatment option?
So for stem cell transplant in myeloma, for years, it's been the standard of care for suitable patients. And every couple of years, I liken this to that game we used to play called King of the Hill growing up, where stem cell transplant's King of the Hill, and then everyone tries to knock stem cell transplant off the hill. And so far, it really hasn't happened. And so transplant still, I think, an important part of the overall care for suitable patients, for patients who are eligible and safe enough to undergo transplant. However, now will this be challenged in the future? And the answer is, I think the next challenger, and this will be a serious challenger, will be CAR T-cell therapy. And so we have to figure out if CAR T-cell therapy or the bispecific antibodies are safe enough to give at the beginning and as effective as stem cell transplant, and what the long-term side effects, how they might differ as well. So that question is going to be tackled in the myeloma world, but it's going to be several years till we have an answer there, for sure. So for my patients who are otherwise candidates for stem cell transplant, but who don't want to do it, usually I'll say, you may change your mind in the future. In myeloma, it's important to keep all your options open, and you should at least discuss with the transplant center collecting and freezing away your stem cells for a rainy day to keep that option open to you. So even if you're thinking of not doing it, it might be a good idea, it probably is a good idea to harvest and store your stem cells at a transplant center. And then if you're not going to go on if you're not going to do transplant up front, the key is to stay on prolonged maintenance therapy. We know that that's one of the keys for making survival as long as possible in patients who don't do a transplant, is to continue on ongoing maintenance therapy as long as possible. Don't curtail your therapy just because you're not doing a transplant.